Welcome to Medically Speaking. My guest today is Dr. Lad Levy, professor and chair of the Department of Neurosurgery at the University of Buffalo and the director of stroke services for Kaleida Health. Doc, thanks for joining me today.
Thank you for having me, Mike.
So, Doc, you go back to the Miller Gates days, and you were instrumental in the creation and the formation and the building of the Gates Vascular Institute. Pretty remarkable that we're at the 10th anniversary right now. Take us back to those days, those early days, and what was it like embarking on that journey and knowing that you guys not only were changing healthcare locally here, but really transforming stroke, neurosurgery, and cardiac surgery across the country and potentially the world. What was that like, those early days?
It was amazing. And I'm glad you brought that up, because people need to remember that intervention for stroke, the ability to pull that clot out of the brain in the middle of stroke, just like you stop a heart attack, stopping a stroke, that started here in Buffalo when I was a fellow in 2001 under Nick Hopkins, whose vision was a GVI, Gates Vascular. People weren't doing this. So we started doing this in the old Millard. And I remember presenting this at national meetings, and people would say cowboys. And I remember the chairman at one very famous institution stood up and said, quote, "If I had a box of tomatoes, I would throw them at you." So we fast forward to the GVI. Now we're sort of a local epicenter for stroke. Everyone in the world is watching what we're doing at the GVI. And they go from tomatoes to, I think they're onto something. And in 2015, when we published a trial in New England Journal of Medicine, along with several other of my colleagues, we created a paradigm shift around the world. Stroke was no longer a disorder of rehabilitation. It became intervention. And the epicenter was Gates Vascular.
For the viewers out there, maybe if you can just explain the difference. When you first came in, you talked about that fellowship that you were involved with. Neurosurgery was a very invasive procedure, talking about cutting of and opening up of the skull and things like that. And then you guys moved it into a much less invasive procedure. If you can, walk the viewers through what that looked like then versus what you guys do today with your stents.
Great question. So there were basically two places for neurosurgeons in the country thinking about that. Believe it or not, one was Philly and the other was Buffalo, and with Nick Hopkins at the old Millard. And he had a vision that, can we create technology and devices? And a lot of that technology came out of Toshiba Stroke Research here at Kaleida and UB in partnership, can create these miniature devices to go through the vessels of the body, the natural highway. Instead of opening the head, we like to say cracking the coconut, peeling all these layers and dissecting brain. Can we get to the lesion via the natural highways, your arteries and veins? And that was the vision. And not just the brain, the heart, the rest of the body. And that was also sort of the nidus or the spark that created Gates Vascular. All the body is connected by these vessels. Can we use these vessels as highways to treat disease states?
And for the patients themselves, having a much less invasive procedure, that means what? Is it shorter stays, less bleeding, quicker recovery? What does that mean for the patient?
Tremendous. It means maybe no anesthesia for older patients who can't tolerate anesthesia. It means no large incision on their face or on their head or on their chest. It means being able to go home after an overnight stay and back to work and back to your family versus 3, 4, 5 days in the hospital, an ICU stay, and then recovering for 4 to 9 weeks, depending on how invasive the surgery is. It meant surviving. It meant being functional. And for the system, it meant lower cost of care, bending that cost curve. All eyes, I mean, it was an amazing transition. All eyes were on us in those early to mid 2000s and 2010 to 2015.
And so the patient care aspect obviously is a huge advantage, but you also talked about working together alongside, say, the cardiologists and cardiac surgeons. That notion was really transformative back 10, 12 years ago, because you guys really worked in silos. All hospitals seem to work in silos. The cardiac docs are here and the stroke docs are here. What does the GVI do by bringing all these disciplines together, and how does that work?
Total paradigm shift and catapults the development of technology and patient care, to your point. So, we have a heart issue while we're on the table. Who knows where the cardiologists are? They may be having a stroke or a brain issue, or they need to get access, but they don't have the tools. So now working with people like VJ Iyer and Dr. Fadki and so many others here in tandem, I see their devices, I see their technologies. We're doing procedures together, brain AVMs, where I need them to stop the heart for me. They can come in and pace the heart, stop the heart, or they need us to get access in the carotid artery to help them do their TAVRs or other procedures safer. We are basically not only revolutionized how we do these procedures, but we've developed novel technology right here in the GVI, in the translational center floors. Amazing.
Yeah, amazing stuff. So one probably wouldn't have believed back 10, 12 years ago that Buffalo has become a destination for not only treating stroke and cardiac procedures, but training physicians, creating and trialing technology. How has the GVI transformed, Buffalo for a place that we can now call a healthcare destination?
Certainly, it's a healthcare destination in neurovascular. I can tell you that both Dr. Siddiqui and I treat patients from Middle East, Europe, Asia, not infrequently, as well as nationally. We have patients come from Tennessee, from the West Coast, sometimes from just New York City, downstate. Certainly is a destination, but not only for patients. Healthcare systems bring their administrators and their leaders and march them through the GVI to see what does the future of multidisciplinary healthcare look like when you break these silos down and doctors and researchers work together with no walls. What can that look like for the advancement of technology and patient care? That is what now GVI is synonymous with, and that is why monthly we're seeing hospital systems bring their leadership teams through this facility.
You mentioned technology. I'd be remiss if I didn't ask you about some of the newer pieces of equipment that the GVI has. Talk about something like the 4D scanner. What is it and why is that so important for the patients that you guys take care of?
Wonderful question, Mike. So we have published for the last decade that every minute 2 million neurons die. So think about that. So if a patient comes in with a stroke and we put them on a CAT scan and we say, oh, wow, you're having a stroke. Let's bring you to the cath lab and pull that clot out of your brain. Even if it takes 20 minutes to transport, that's 40 million neurons, right? 2 per minute, 40 million neurons. If I'm doing the math, I know I can't afford 40 million neurons to get lost. So let's assume if we can eliminate that road trip and right there in the ER, you have the CAT scan falls away, the stroke machine comes in and we start doing our stroke surgery right there on the 4D CT. Less time means better outcomes. And that's what it's about. And we want to thank Kaleida Health for investing in this technology because it was purely a patient-centric investment. So thank you.
Sure, absolutely important stuff. When you talk about those types of investments and all the progress that you guys have made, when you look back 10 years up until now, and I know your mantra for the team is time is brain. How has that impacted the community? How has that impacted patient care? All those advances as you guys have helped lead, not only here, but across the country and across the world. What has it done for patient care?
So I would say locally, the patients in Buffalo get the best care in the world. They're sort of what I'd say first at the trough of new technology. So as technology is developed here or elsewhere, because of our academic footprint, and we've been in this space almost longer than anybody, companies, scientists, they bring their new technologies here for us to be in their FDA-approved trials. So every time patients come in to have a stroke here, they are getting the latest and greatest devices, whether we've developed them or they've been developed outside the US. So they have access to the latest trials, the latest data, and truthfully, the docs at Kaleida Health, Jason Davies, Adnan Siddiqui, Ken Snyder, myself, we have probably done more stroke interventions than any other group in the country. And that is not an opinion, that is data-driven.
I guess the last question is probably both the easiest and toughest. If I had asked you to take out your crystal ball, look out in the future, say what happens over the next 10 years? You've celebrated 10 years there already, but what do you see over the course of the next 10 years I know you guys are always working on emerging technology and equipment. What do you guys envision?
I would envision that GVI becomes a stroke center for the globe. With the development now of robotic technology and there are companies that can do robots, if there's somebody having a stroke, not only in Buffalo, but in Bangkok or Bangladesh, and they have the robot and we have the robot, can the skill sets that we have acquired here treat a patient remotely in Bangladesh, in Bangkok, in Buffalo, using robotic technologies? That, I think, is what I envision a decade from now.
Certainly exciting stuff. Well, Doc, congratulations on a decade of achievement for you and the team there at the GVI. Best of luck moving forward. I know you guys have an awful lot going on, so we appreciate your time today.
Mike, thank you. And I can say that this has been an amazing 10-year ride. And I cannot thank Kaleida Health and their donors and the leadership team here, because without that partnership, we could not have accomplished what we have done for the stroke community. So thank you.
Yeah, thank you. Dr. Elad Levy is professor and chair of the Department of Neurosurgery at the University of Buffalo. He's also the director of stroke services for Kaleida Health. Doc, thanks again.
Thank you.